Hi, everybody. I hope that this is live on Facebook right now. Trying to set it up from Zoom here. Thank you so much for joining me today on Wellness Wednesday. I'm Dr. Kosciuszko. Just going to record this here. I'm so happy to have you joining me today because I really want to delve into this topic. I'm so passionate about it, and I really want to help draw parallels for you on why I talk about trauma so much and why it's important in your health now. Okay, so if this resonates with you, please click that like button, share with your friends, because I have a really big message to get out to you guys today. So if we look at, real quick, the state of what our health is like in general, in the world, in the US, and look at the statistics, and really kind of like zoom out on just taking a bird's eye view of what's going on in the world. If we look at the statistics of some of the biggest diseases that we have that are killing us right now, which are heart disease, stroke, accidental death, the leading cause of accidental death being drug overdose. We have 300 million people diagnosed with depression. We have a slew of all these chronic issues, okay? And I really want to drive this home because the chronic issues that we're having are absolutely, this isn't an accident. This isn't just, this isn't just about, the drug companies trying to make money or whatever. Yes, there is some of that. I definitely think that a lot of the pharmaceutical aspect is built to keep you on some of that and not address the root cause. It's not to say that some of the pharmaceutical temporarily doesn't help somebody with their life and functioning. So remember, like health, it's not about which one of us and what type of provider is right. It's about us as a whole in the world being healthy. And so I just want to kind of drive home some of those statistics and then really look at, root cause, because some of those chronic diseases take sometimes 20 to 30 years for things to develop. Okay. And there's multiple causes for it, but there's the root cause that most often gets driven away or not addressed is trauma, especially in childhood. So adverse childhood experiences, they're called ACE scores. So the higher your ACE scores are, the more your percentage just like explodes for chronic disease. If you even have an ACE score of say 1 or 2, okay, that still puts you in a category for risk for autoimmune disease. The higher ACE scores that you have, if you have 4 or above, you are now double at risk for addictions, double at risk for heart disease, double at risk for, alcoholism, all these other things. If you have an ACE score of 6 and above, 6 out of 10, it is estimated that there's a 20-year life loss from your health. So they're estimating that because of the diseases that get brought on, they're actually estimating that if you have an ACE score over 6, that your life gets short by 20 years because of chronic illness. So why, for some reason, this isn't brought up in general health blows my mind. It blows my mind because that is so big in some of the root causes of what's going on in our society today. Okay, now think about it. We've had in our, my generation, few generations prior to that generation. This is why I talk about generational trauma, because things get passed down, and not just from behavior, but from genetics. Okay, so if you were in an abusive environment growing up, and you break cycles within your behavior, that is awesome. You are a hero, okay? But the other thing is that you still have that trauma in your body, in your genetics. So we want to also think about that and how to unravel that, because all those experiences, they translate to disease for reasons. They translate to disease because you're getting genetic expression of disease genes, because your physiology is matching your mentality. Okay, so if you are in that fight or flight survival mode and you are in an environment where you don't feel safe, if you grew up in the era of kids are to be seen, not heard, or whatever, I don't think anybody gets away with having no traumatic experiences in their life. But the difference between having a traumatic experience, like experiencing or seeing something scary, and then living in a chronically stressful, unsafe environment where either you emotionally didn't feel safe, you emotionally felt neglected, you physically felt unsafe, you physically felt neglected, you had sexual abuse experiences, you had parents with addictions or whatever it may be. Go look up ACE scores. And it's very, very eye-opening, okay? Because, and I really want to drive this home, the reason why half of us aren't getting better, or diseases aren't getting better, is because that is a root that's not being addressed in the population right now. It's not. I had one doctor who asked me if I had a history of abuse, and I literally was like, I was so stunned and I was in massive denial, but I literally was like, no, what are you talking about? And so what that even looks like for people to wrap their heads around is very difficult. It needs to be, this is a subject that I feel like is really pushed down. It's really, because it's so societally normal. You see somebody grabbing their kid in the parking lot and yelling at them or whatever, like nobody does anything, and that's not necessarily the case, but that's what I mean. Like there's so many societal norms that, the way kids are treated, or that it's normal for specific things, because that's what all of us do. I really want you guys to take a moment and just understand that just because something is a societal norm, just because a lot of us are maybe on some sort of antidepressant or anxiety, just because there is, a lot of us binge watch Netflix, just because a lot of college kids go and binge drink at school, and do drugs, things like that, it doesn't mean it's normal. Like those things are normal. It means that our society is in a ton of pain. It means that our society is hurting in general, like generations of these things. So I really, and there's so many levels to this. There's so many levels, because depression this is a layer. In our health, our health is like peeling an onion, okay? We really have so many layers of things that cause disease. And right now in the medical model, we're looking at it from one focal point. We're looking at it on a data sheet saying, okay, this person fits in this box, nope, check that off. Okay, this diagnosis, boom, that's the diagnosis, get the medicine, right? That's how it works right now. What if we were to transition that to look at our health in a different angle? What if we were to look at our health as an entire being, wrapped in layers and functioning on multiple different layers, functioning on the emotional layer, functioning with all their different systems on an energetic layer, right? How are they thriving in their environment? What's their environment like? What's their nutrition like? What's their lifestyle like? Those are all indicators. Those are all indicators on what's going on with somebody, okay? I'll tell you a story. When I first started, what really got me kicked up about this type of medicine is actually watching my own parent pass away, and watching what they went through in the medical system. And if the medical system stopped treating my parent like a number and and labs on a sheet and actually looked at my parents' life, they wouldn't have had all these like misdiagnoses or anything, and like they would have like looked deeper. They would have looked at what's going on. They've been trying to figure out something. My parent died of cancer, metastatic cancer, and they only found out like a few days before he passed. And, you know, needless to say, the whole event of how it happened was traumatic in general. That was a traumatic event for me and my family. But how it went down was so impersonal. And I'm like, man, if they just like looked at his lifestyle and like the cigarettes and the alcohol and like what his life, where he worked, you know, what he was probably exposed to where he was working and things like that, what his life was like, they could have brought, okay, what are those things linked to? Cancer, you know. So, and not to make it about my family's story or anything, but just to give you an example of, you know, I've watched firsthand and I've had the trauma instilled in me firsthand on somebody passing away and like somebody just being treated as a number, and you're not looking at the roots. They're not digging into it. They're running labs, they're running traditional labs because that's within the scope, and they're checking off boxes to make sure none of the big boxes are checked off, making sure everything's fine. So really, I tell you all that today, and that's very personal. And that was a very, very difficult time for me. I was 14 years old when that happened, and again, still a child, and that's a heavy trauma. You know, if this continues, if we as a society continue to ignore the roots, to ignore what our food is like, to ignore what we have been through as a person, to ignore what we're taking in our body, to ignore what our habits are and our addictions and stuff, then we are going to continually miss, and that we're going to go down this path where we're not getting better. We're just band-aiding. Everybody's just band-aiding and numbing and looking the other way. And it's causing so many problems. We're seeing numbers rise. We're seeing numbers rise in chronic health disorders. And there are so many people undiagnosed with autoimmune issues that don't even know they have it, that are linked to ACE scores. So that is one of the reasons why I talk about trauma. The research and statistics are really there. If you want to learn more about ACEs and ACE scores, I will post a link below for you guys to go check that out. Again, this is more, there's so much more that comes with that. And I'm not a psychiatrist, but as a physician, I feel very strongly about digging into the root cause for the individual. And it's so important that the person comes in, if somebody is searching for why their health is poor, that is a huge piece of why. And for a lot of people, people I've seen, people I've treated, people I've coached, and a lot of them, it's not even the worst part is how trauma shows up, especially if it's young, is it actually gets stored in your brain. It gets actually compartmentalized for security reasons, to keep you safe, to keep you still living as a child. And so when you are, when you are an adult, this is why it's more important that the ACEs are linked to it, not just trauma as an adult. If you experience trauma as an adult, you are one step ahead. I mean, you're 5 steps ahead, really, because your brain has been, formed, and you have, you don't have those things working against you, right? So if you had a great upbringing and you felt safe and loved and you're a thriving adult, and then you experience trauma, your ability to bounce back and heal from that trauma is much, much, much greater. And the damage that you might face is much, much, much less than what you might experience if you were, experience trauma with the brain of a child. Much different. Okay, children are much more impressionable. Children's, again, their brains are developing. Different parts of the brain actually get structured differently to adapt. So if there is a chronic toxic stress in the home, it's really important to know that that child's physiology is changing. It's changing and adapting to that. Right. So I feel really passionate about this because I feel like it's also, you know, my duty as not only a physician, but a mother that, you know, this is really important. And the only way that this is going to change in our society is that we address it. You know, it starts with me and it starts with you, and it starts with understanding and bringing into our awareness of what, you know, what we have truly been exposed to on an emotional level, on an energetic level, on a physical level. So that really means like taking in awareness on what we're eating, our habits, you know, all that stuff matters. It really, really, really matters. And if we are unaware of those things, what's going to happen is it's going to jump right from us to our kids, okay, in multiple different ways. Genetically, the way our bodies, unfortunately, we carry genetics for trauma. If we have already, especially if our parents have had trauma, they pass those genetics on to us as well. So those genes can get more easily expressed. So that's important to know, that part of breaking the generational trauma and helping yourself with chronic illness is not just backing up, but also helping yourself and your children to kind of unwind those genetics a little bit. Okay, so epigenetics is really more of an expression of genes. This is a newer term. It's basically that your genes, you're not basically stuck with the genes that you have. You can have genetic expression. You can turn on and off genetic expression, in particular disease genes. So trauma is one thing that actually sets off and triggers disease genes. So that's a piece of it. So this should never be overlooked. And it's important that when you are considering helping yourself, I would highly recommend taking the ACE scores test to see where you fall on it and what consists as an adverse childhood experience. I was like, oh, I'll probably get like a 3 or a 4. I was at a 9. Like, I literally took it. I'm like, oh my God, I'm gonna like die next year. Something bad's gonna happen. I was like, I'm 37. How am I gonna live longer than this? I don't know. Oh my God. So, and as much as of it as was fearful to me, like, oh my God, like it was also a smack in the face. Like, this is real. This is your life. This is your life. Like you need to take care of yourself. And this is real for you and your kids. Like your kids already have 1 ACE score. They already have a parent with PTSD, you know, who's had chronic fatigue. So this is all linked. Okay. Now, I don't want this to come across as like doom and gloom. What I really want this to come through as is definitely awareness. Definitely, you know, we need to start addressing this as a society in general. I highly think that this should be addressed. And also to get across from you, like, if that is you and you have high ACE scores and you are somebody who's been struggling with chronic fatigue and somebody who's struggling with depression or eating or binge eating or anything like that, I just want you to know how not alone you are and how many people are struggling with this, how many millions of people are struggling with the similar thing. So the one thing that I want you to take away from this is the awareness that that is playing a role in your health, okay? And that it is possible to turn that around for yourself and create a better health and a better life for yourself. So that is so important. If you have that awareness, if you are somebody who you realize that you do have high ACE scores and this is kind of a root cause for you, that's powerful information. That's so powerful. And it's liberating, right? If you have been somebody who's kind of been banging your head against the wall saying, I don't know what is wrong. I have been to multiple different doctors. My tests are coming back normal, this and that. This is, they're not digging far enough, because it's never just it's never just okay, like it's in your head. No, like there's a lot of reasons why you're having the symptoms that you have. It's just getting to those underlying causes, and trauma is a big underlying cause. Okay, so I want this, if this resonates with you, please click that love button, comment below on how this helps you. I know this can be a very daunting subject too, that realization of the, like your ACE scores can actually feel like somebody came and kicked you in the teeth. It really can. It can feel like, oh my God, like I didn't realize that. Like I didn't realize that was, you know, that, like I thought that was normal or whatever, you know. So it can be, there can be a little bit of a shock element to that, and that's okay, and know that's normal, you know, and know that wherever that you did come from or experiences those experiences, it comes from a lack of awareness from generation to generation, you know. And so if you are somebody who is experiencing that, you're not alone, and there are absolute ways to turn your health around and get more answers. Okay. But I really wanted to just draw those lines with how trauma affects the health and give you guys some of those stats today, because that's so important. If you feel compelled to share this with your friends, I think this is a really important message to get out there. So I'm going to end there today. I'm Dr. Kosciuszko. Thank you so much for joining me on Wellness Wednesday, and I will see you guys next week. If you want to have any other topics, me cover any topics or any specifics, comment below too, and let me know what you would like to hear. Okay, thanks so much.